Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then diagnosis of primary hyperparathyroidism. So if you see the diagnosis of primary hyperparathyroidism, so diagnosis is we should take elevated serum creatinine and intact parathormone are important things for diagnosis of hyperparathyroidism. You will see that there is increased calcium is seen and increased parathormone is also seen. Along with that, the patient will have decreased phosphate and also elevated 24-hour urinary calcium is also elevated. In primary hyperparathyroidism, because of increased serum calcium which is elevated, this is excreted in the kidney, thus resulting in increased 24-hour urinary calcium also. Then, for localization of the tumor, we can also do a system scan. That is, technetium labeled system scan is mainly done for localization of the tumor. This technetium labeled system scan is widely used and it is the accurate modality. Then if you see the treatment of primary hyperparathyroidism, because there is parathyroid tumor is present, we should do parathyroidectomy is done for the treatment of hyperparathyroidism. And here, along with the parathyroidectomy, we can also give the patient selective estrogen receptor modulators and bisphosphonates are given. Why are they given? They are given mainly to lower or decrease the calcium levels, and they are also given to either to one to decrease the calcium levels and to decrease the osteoporosis, and thus they will increase the bone mineral density in a patient with primary hyperparathyroidism. But the best important is parathyroidectomy, especially if the patient has the 5 triad or classical symptoms, then it is better to do a parathyroidectomy. Now, what are the indications of parathyroidectomy in a patient with primary hyperparathyroidism? Now, in a patient with primary hyperparathyroidism, we have 8 indications. Right. Primary is number 1, when the serum calcium levels is more than 1 milligram per deciliter above the upper limits of normal, that is hypercalcemia or increased calcium levels more than 1 milligram per deciliter, obviously we should do a surgery to make sure that the calcium levels are normal. Then if the patient has life threatening hypercalcemic episodes, then we should do a parathyroidectomy. If the creatinine clearance is reduced by 30%, or if the kidney stones are seen on abdominal x-ray, or if the patient has an elevated 24-hour urinary calcium excretion is more than 400 milligram per deciliter, or if there is decreased bone mineral density at the lumbar spine, hip and the distal radius, or if the age of the patient is less than 50 years, or if there is long-term medical surveillance is not desired or not possible, in all these cases we should do a parathyroidectomy is indicated even in asymptomatic primary hyperparathyroidism.
thank you and thank you for watching.